I was 45 years old when my mother was diagnosed with Alzheimer's. She was 69 at the time. I was her primary caregiver and still am. She lived with me for 3 years until she had a heart attack.
At that point, we made a family decision to move her to Macassa Lodge.
So she's in long-term care, and she's not the same mother we've known. She's a different person. She doesn't know us, but we still love her the same. We go in, we laugh together, we sing, we dance, we have fun. We love her.
The human brain consists of 100 billion neurons that form communication networks that are interrupted by plaques and tangles, resulting in Alzheimer's disease. A plaque is a buildup of beta amyloid fragments between nerve cells, while tangles are the twisting tau fibers within the cerebral cortex.
Now, the way Alzheimer's affects people is on two fronts. First, it affects the caregiver as well as obviously the patient. The caregiver's health is rather important in this case. It was shown in a study that if the caregiver doesn't have any kind of support group, then the Alzheimer's patient's symptoms seem to worsen. However, if you give this same caregiver a support group, the Alzheimer's patient health begins improving as well. Now, obviously, what the Alzheimer patient encounters is a myriad of symptoms. For example, they suffer from general cognitive impairment, memory loss, problem solving, as well as trouble recognizing familiar faces and familiar places.
Prevention of Alzheimer's disease is an imperfect task. Maintaining proper nutrition, regular exercise, and a stress-free environment will benefit any individual's brain health. In addition, avoidance of drugs and narcotics, poor nutrition, and lazy habits will help mitigate Alzheimer's disease.
So in terms of treating the disease, there are primarily two types of ways you can do it, through medicinal or gene therapy. In medicine, the primary forms of treatment involve cholinesterase inhibitors, as well as other neuroinflammatory and cognitive impairment medications. And in terms of gene therapy, there's a linkage between the APOE gene and its 4 different variants in Alzheimer's disease. And for example, the E4 variant is linked with a positive correlation of developing Alzheimer's disease, as opposed to the E3 variant doesn't have that said correlation. So if you perform some kind of way of removing these point mutations to produce these variants, you might be able to reduce the chances of Alzheimer's or treat the disease itself.
So in terms of coping with Alzheimer's disease, you can either cope as a caregiver or you can cope as a victim. In terms of coping as a caregiver, there are certain symptoms associated with a person with Alzheimer's that are called neuropsychiatric disorders, such as depression, mood swings, and psychosis. And these are found to be the most disturbing to the caregivers, as it makes you feel like you may have lost someone that you've loved your entire life. So one of the ways you can mitigate this is by developing a repeatable schedule with a person with Alzheimer's. By doing this, it will help reinforce the fact that the person with Alzheimer's is going to know what's happening day to day, and it might bring back some of their old habits and get them out of depression or anxiety. And another supplement to this can be something known as counseling, where you go and see other people who have been living with a person with Alzheimer's, and it's really helpful to know that you're not alone when going through these things. In terms of coping as a victim, the main thing with this is you want to live in the moment, because if you're stressing and you have anxiety about future events or things you can't control, or perhaps things that are happening with your mind and body, that's going to be extremely detrimental to you. So meditation is a practice of focusing on now and living in the moment. So it trains your brain to wander for a little bit, and then it brings you back to the present. And by doing this day after day, it'll teach your brain to live in the present. So these are just some of the ways that caregivers and victims can cope with Alzheimer's.
A take-home message according to the literature deals with the vicious stress cycle. What the vicious stress cycle indicates is that stress further progresses cognitive impairment in Alzheimer's disease patients. Once you have Alzheimer's disease, what the disease is known to do is disrupt stress circuits, resulting in anxiety, depression, and aggressive behavior. So the take-home message here is to keep your environment stress-free for those dealing with Alzheimer's.
Now, another tip from the literature focuses on the management of the disease, and it focuses on the drug INT-777. INT-777 treats LPS-induced conditions, also known as lipopolysaccharide-induced conditions. These conditions are very similar to those of that of Alzheimer's. Some of them include neuroinflammation, other neurodegenerative ones, or cell death/cell apoptosis. How INT-777 treats these conditions, 777 treats these conditions, is through TGR5 expression. So this is a protein that, if it's upregulated, it can then kind of counteract the neuroinflammation and the cell apoptosis and the other